This presentation concerns policies to eliminate drunk driving. Alcohol-related deaths is a public health issue that results in 29 people in the United States dying every day by an impaired driver. This accounts for one person dying every 15 minutes. More than $44 billion is spent annually on crashes related to alcohol. Other facts reported by the CDC for 2016 include 10,497 people dying in alcohol-related driving accidents, 214 children ages 0 through 14 died as a result of an alcohol-impaired driver. The number of drivers arrested for driving under the influence totaled more than 1 million for alcohol and narcotics. Who is more at risk for alcohol-related accidents? Young adults are found to be more at risk of being involved in an alcohol-related crash than older adults. In 2016, ages 25 through 34 accounted for nearly 3 in 10 fatal crashes, while the next two largest groups were ages 21 through 34 and 35 through 44. Motorcyclists are reported to have blood alcohol concentrations of 0.08% or more in alcohol-related crashes, with ages 35 through 39 having the highest percentage. The CDC also notes that impaired drivers with a BAC greater than 0.08 that were involved in alcohol-related crashes were 4.5 times more likely to have been previously convicted for DWIs. The effects of blood alcohol concentration. The effects of alcohol on the body can impair driving after just a few drinks. With a BAC of 0.2, which is 2 drinks, there is loss of judgment as well as the loss of ability to perform 2 tasks at a time. After 3 drinks, with a BAC of 0.5, there is decreased alertness, with the outcome producing difficulty in steering. At a BAC of 0.8, which amounts to about 4 drinks, there is poor muscle control, resulting in difficulty controlling speed and impaired perception. Individuals with a BAC of 0.15, which amounts to about 7 drinks, has even less muscle control and have even less control over controlling the vehicle and performing tasks. Supporting research. In relation to BAC levels and driving, research has noted that alcohol affects the driving capabilities in many ways. The effects include attitude, judgment, vigilance, perception, reaction, and controlling. Also, the study revealed that the higher the BAC level, the higher the accident rate. A driving performance analysis indicated that impaired drivers have a higher incidence of average speed deviation, lane deviation, and standards of speed deviation. Serious accidents have a high probability of occurring as a result of drunk drivers. Proposed interventions. To protect public health, decrease healthcare costs, and prevent deaths caused by drunk drivers, policymakers should enact laws that deter the consumption of alcohol while operating vehicles. Interventions that should be enacted include removing advertisements that glamorize and promote alcoholic beverages, prohibit airing of alcoholic beverages on channels that young people are likely to watch, and third, require that all vehicles have ignition interlocks installed. Supporting evidence of proposed interventions. Alcohol marketing is present in every aspect of communication method that is accessible to children and adolescents. Research has shown that although the alcohol industries have tried to promote self-regulating programs, the efforts are not effective. It is the government's responsibility to protect the health of its citizens, especially the children and adolescents, from pressures that may influence them to consume products that are harmful to their health. Other evidence to support the proposed intervention is a study that was conducted on the effects of ignition interlock laws. Data from 1999 to 2013 provided by the National Highway Traffic Safety Administration showed that 15% fewer deaths were alcohol related. There are several advantages to breath analysis technology to prevent intoxicated drivers from taking the wheel. These devices requires the individual to breathe into it for a test of the BAC. If the reading is above the preset BAC, the vehicle will be unable to start. This concept has reduced the prior drunk drivers by 50 to 90%. Benefits to enacting policies. By voting for and adopting these policies into law, the influences of consuming alcoholic beverages will be reduced, healthcare costs will be reduced, and a healthier environment will result from lives not being lost by the actions of drunk drivers. I encourage policymakers to act upon these interventions, which can enable each state to benefit in all areas of prevention, protection, and preservation.